An example of good practice I would like to highlight, it's about entrepreneurship, and we're developing different programs about developing entrepreneurs and helping entrepreneurs in bringing ideas to the market. And I say this is a good practice because, first of all, we're helping basic research institutions such as universities and hospitals get their innovation out of their research projects and help the ideas reach the market. We're helping building professionals that can run these kind of projects, and also we're helping them access to finance. So I think this is a specific role that not many organizations are playing, and that it's a good practice example for clusters.
Traditionally, PhDs have a kind of academic career. They have the postdoc period, and then they have an academic career, or they are aiming for that, but only 1/3 of the PhDs in Helsinki region and in Finland can get an academic career, and then the rest, they have to find jobs somewhere else. And some, of course, them want to work for the industry, but so they need kind of a broader skill. So we have created a program which we are executing together with the graduate schools. So the PhDs that are graduating, they get kind of business skills, they get some career coaching, they get some negotiation skills, and they are more ready to go to work in the companies. And actually I'm going to talk about that tomorrow for this audience, and I think that's one of the good practices, and we've had a very good success with that.
If I have to give a good example of good practice in the management of the cluster, I guess that the new labels of quality of management that the Commission is about to give, I mean the bronze medal or the gold medal that it will give to the cluster for the management, will be a way to level up the qualitative management and the way we're going to push forward that initiative and that policy in the further years. So I guess that it's a good idea to have some kind of quality control of what we are doing and a leverage up of the way we are managing the health clusters today. So I think it's a good, positive element.
I would say that a good practice that I could share in good cluster management, for at least in our example in Portugal, would be the sustainability that we created. And what I mean is, we were in the beginning public funded, and afterwards we had other partners, private partners, and we set up our model within our own services to the community, and by that I mean R&D specialized services, supporting services to all the community, R&D in collaboration with all different partners, and so having our own income helps us to be focused and to go where we want to go, that is, to be internationalized.
The most innovative approach that clusters can give is finding the interfaces between public and private initiatives, and especially at the conversion of different technologies. And I will explain. For instance, we all know that maintaining a sustainable healthcare system is one of the main challenges we're all addressing. And how do you do that? And that we have tons of exponential technologies now that like artificial intelligence, personalized medicine, regenerative medicine, that are going to have a strong impact on making the healthcare sustainable. But that means finding the way of putting together the knowledge, the companies that are developing these kind of devices, the clinicians that are practicing every day and know what kind of technologies are needed, the administration that, after all, in the end is going to be the one to pay for them. So all the projects that are focusing towards putting together technologies in the healthcare system and developing long-time programs to achieve this goal, to me, are the ones that are right now the most relevant ones.